I enjoyed becoming empowered by doing my literature review. I would see a compelling headline, but no, it's a .com site or a site no one had ever heard of. No, not good sources. Instead, I would usually start with the Mayo Clinic. The articles are easier to read, complete, and up to date. After the Mayo Clinic, I checked the National Library of Medicine. Then I looked for articles in Lancet or JAMA. After arming myself with this reading, I feel I can at least hold a credible discussion and be prepared to answer and pose questions about the content. As far as the literature review, I found the repetition to be frustrating, working on one paper the entire semester, but it made that work complete. What I further found frustrating was that my study, Do PET-Assisted Therapies Aid with Symptoms of Depression in Dementia Patients, clearly shows that PET therapy is incredibly effective with patients and their neuroplasticity. Neuroplasticity is like your brain, the space in between. It's like neuroplasticity. It's supposed to be like clear and fluid. Neuroplasticity, it builds up like cobwebs and dust bunnies in there is the best way I can think to describe it. And but when you have a dog, it clears some of your neuroplasticity. So my purpose statement is as follows. The purpose of my study is to test PET-assisted therapy as a treatment for depression in patients with dementia. The independent variable is PET therapy, which can be anything from adding a fish to the common area of a facility, to a cat that lives in a long-term facility, to a dog that comes once a week. The ability to control their aggression is the dependent variable of interest in these patients. And that is one of the complaints about PET therapy. There's little or no structure to the sessions. Descriptive statistics include the number of people in the survey, the numbers that show how their mood is changed with PET therapy. I offer these survey results as proof of success with PET therapy. This statistic could then be changed to inferential by using the descriptive statistics more widely to make these numbers applicable to other elderly persons. The descriptive statistic in the elderly population of both the control group and the PET therapy groups. Inferential statistics allow you to imply if PET therapy works for 90 out of 100 patients, the statistic could be applied to a larger population with the same demographic. I would like to conduct a convenience sample survey before and after PET therapy sessions to compare the results. The interview would be conducted on the internet with a few mouse clicks. For those patients unable or unwilling to use a computer format, a paper survey could be given, and an oral record of responses could also be recorded for patients with cognitive dysfunction. Therapy dogs increase the motivation to participate in the study and help to build a rapport with participants and create connections that enrich our data. For example, it has been documented that PET therapy reduces cardiovascular stress, enhances immune factors, decreases pain, increases mood, reduces cortisol levels, decreases fear and anxiety, and overall creates a humanizing atmosphere in a long-term care setting. Our study demonstrated that the presence of a certified therapy dog increased many patients' motivation to participate in the study and helped create a safe and open atmosphere that enables patients to connect with others, an animal, and a researcher. In short, therapy dogs bridge the gap between hard-to-reach populations and researchers. Patients with depression, schizophrenia, or dementia in particular often lack the motivation to complete everyday tasks. In our study, the therapy dogs helped counteract the tendency of patients with mental illness to self-isolate. That's something no medication could do. That is a very, very important thing, and I wish that pet therapy was included in all long-term care places. Petting and interacting with the dog also humanize these encounters and bring comfort to the patients, even in the midst of mental health crisis. These findings are so clear. In my mind, everyone needs a pet to enter older age with the best brain plasticity possible. Pet ownership seems to be the key. The literature reviews all come to the same conclusion. Dementia patients that are verbal hold longer conversations and more complex conversations after pet therapy sessions. Aggression is lessened with pet therapy, and less agitation is shown in patients with pet therapy sessions. My method would be expression to measure the severity of symptoms, to measure a patient's response to pet therapy treatment. The PHQ-2 and PHQ-9 are validated tools developed and owned by Pfizer. They are quick to administer and easy to score, making them ideal for use in the senior population we're working with. Privacy and confidentiality are ensured with this type of survey, and confidentiality is important for an honest response to a survey. The survey's PH9 is a depression module, which scores 0 to 3. The PH9 scores moderate, mild, severe, from 5 to 20. That's how they score that one. Depression is the most prevalent and treatable of all mental disorders, with questions like, how difficult have these problems made it for you to do your work, take care of things at home, or getting along with other people? Gauging this with a scoring guide, it gives the professionals a guide as to the patient's state of depression. The PH2 is used also to screen for depression. The participants in these groups were anywhere from 58 to 95 years of age. I would offer the patients a survey after their dog therapy session. Their answers would give you a gauge to go by as to mood levels and anxiety before and after the sessions. I would also offer the survey to patients that had rested for 1 hour instead of participating in the sessions. The difference in these numbers could give you accurate looks at levels of depression before and after pet therapy. Ensuring confidentiality is very important to patients as utilized in the survey. Their privacy should be ensured given the procedure for filling in these surveys. Confidentiality and privacy is of the utmost importance and ensures people will answer the surveys honestly. Reaction to pet therapy is overwhelmingly positive and should be used as a treatment for dementia. But the pet therapy treatment should be more structured as far as exposure to animals, what type of animals, how long. Some pets live in a place, some pets just come to visit for an hour. But I think to enter old age in the best shape possible, which is what we all want to do, we should own our own pets, because owning our pet will make for the best plasticity in our brains to enter elderly age with. Thank you.